This skill is upper bed bath. So I'm gonna wash hands, knock knock. Good morning, my name is Xavier, I'll be your CNA for today. Is it okay if I check your name band? Mary Smith, nice to meet you. How would you like to be addressed? Mrs. Smith? Mrs. Smith, is it okay if I help you with your upper bed bath? Alright, so I'll be back with the supplies. So I'm gonna wash hands, step outside, grab my supplies, and then I have my supplies now, so I'm gonna wash my hands again, and then I'll close the curtains. I'll raise the bed to a comfortable position. I'm gonna lower the side rail. And I'll put on my first set of gloves. So the next thing I wanna do is place towels underneath the patient. So one of the towels is gonna go underneath their head. If you can raise your head for me. Another towel over the chest. And then another towel underneath the arms. I have my water, it's 105, so I test it, I have the patient test it, they say it's fine. And then I'm gonna make a hand mitt. So first I'll start with the eye. So I'm just gonna get water, start with the eye farthest from you. So 1, 2, using a clean corner, index, pinky. Rinse, 1, 2. Would you like any soap on your face? So they say yes, water, soap. We're gonna clean their face in a square-like motion. Rinse, you can even squeeze it as well. And then pat dry. The next thing is the neck. So you got water, soap. Start with the farthest side from you. Rinse. And then pat dry. The next part will be the chest. So I'm actually going to lower the bath blanket underneath. I'm gonna only expose one area at a time. And if the water becomes soapy or cold, I'm gonna change it. So water, soap, circular motion, rinse, water, soap. I'll clean underneath the breast, so lift up the breast with the back of your hand. Rinse, and then pat dry. Now I'll expose the abdomen. I'll make a hand mitt. Water, soap. Also check for any redness, any skin abnormalities. Rinse. Pat dry. So now I'm gonna move to the arm. So the arm, just expose one area at a time. So shoulder and armpit, upper arm, lower arm, and the last will be the hands. So I have water, soap, shoulder, armpit, rinse. If you can please lift up your arm for me. Pat dry. And then I'll do the upper arm. So again, make a hand mitt. Water, soap. If you can lift up your arm for me. Rinse. Pat dry. And then the lower arm. So again, checking for redness, any skin abnormalities. Water, soap, rinse, pat dry. And then at this point, I'm just gonna verbalize that I'm going to change my water, change my gloves. So my old washcloth, I can put it into the hamper. And then I have new water, new gloves. So I test the water, it's 105. Mrs. Smith, can you test the water? They say it's fine. And I have a new washcloth. I'm gonna get some water, soap, clean the hands. This one now can go into the hamper. And I'll soak the hands for 3 minutes. So 3 minutes has passed. I'm gonna pat dry the hands. And I'll say I'll do the same thing on the other side. And then at this point, with the gloves on, I'm gonna remove all the towels. Please lift up your arm for me. And always keep the patient covered. Wash hands. And then I make sure to lower the bed. Make sure that they're aligned. Make sure that the bed is locked. And then my last set of gloves will be to clean up. So I'll dump, rinse and dry, put this in their personal belongings, and then all of these will go in the trash. Wash hands. Mrs. Smith, here's your call light, your phone, tissue, water, and magazines. If there's anything else you need, just let me know, and I'll be right back. So I'll open the curtains, I'll wash my hands, step outside, record, and report. If the patient has a rash, you want to make sure to use hypoallergenic soap or mild soap. You know where the rash is and you make sure to notify the nurse about it. You're going to make a hand mitt. You get water, soap, pat the area. Don't rub it because you don't want the rash to spread. Rinse it, and then pat the area. And then at this point, you want to make sure to change the water, change your gloves, and change the washcloth before you proceed to the next part.